High school students at Crest Academy say they've made some discoveries on COVID-19 through a recent research they conducted. Here to discuss their findings are Saanvi Sheoran and Isha Popat of Crest Academy. Thank you for joining us.
Thank you for having us.
This started, we were just talking off camera, this started as a competition that you guys were in, right? Tell us about that.
So basically, Data Jam is this data science competition that actually started in Pittsburgh. And what they do is they encourage high school students and community college students to participate through researching different projects and conducting statistical tests.
Okay, and you started this in January.
Yes.
Did you start with a goal?
Yes, so as high school students deeply motivated and passionate for healthcare, we decided to investigate whether there was a statistically significant difference in vaccination rates between counties with a high median income compared to low median income in the United States.
And where did you get your data?
Yeah, so we took our data from the CDC and the US Census, and basically what we did is we took the vaccination rates and the median household income per county for all the counties in the United States in 2022. And then from there, we categorized a county as high or low income, depending on whether it was above or below the national median at the time. And then from there, we conducted a statistical test to determine whether lower income households also have lower vaccination rates compared to higher income households.
And what did you discover when you crunched the numbers?
We found that lower income households do have lower vaccination rates compared to higher income households, but beyond just this, we found that the difference in vaccination rates between the two groups was really, really extreme, and that was the more surprising part of our data.
And they're lower income, but you could get, the shots didn't cost anything, did they? I'm trying to remember. No,
they didn't.
They didn't.
Yeah.
So what would cause that disparity, do you think?
I think that that's the most important part of our research, because since they made the vaccines free, that means that cost wasn't really a big issue here, right? So then that pushes for more research to look into more deeply rooted systematic inequalities, and that also gives us more reason to push for measures to help mitigate the gap between these two income groups.
And do you have any measures in mind specifically?
Yes, so our research points to clear need for localized, equity-focused public health infrastructure. And we believe that counties should take use of data such as the Social Vulnerability Index in order to allocate resources by need. And in addition to this, they should fund public mobile clinics and multilingual outreach programs in order to reduce the practical barrier. And finally, we believe that they should enact local legislation in order to create permanent change in contrast to temporary responses to crisis.
Okay, this is not necessarily COVID, but like you said, you just used the word crisis.
Yeah.
Like a health crisis?
Exactly.
Okay, so now you have all this research and you know what you want to do. What's your next step?
So our project is not just about research, now it's about action. So we're currently reaching out to policymakers to hopefully enact change starting locally. And we want to expand our research to being not just of vaccines, but all preventative medical care. And in addition to this, we want to expand beyond the United States and look at global trends, and specifically in regions where healthcare access is already limited. And finally, and most importantly, we want to continue healthcare advocacy because we believe that healthcare deserves equity. And we believe that it's not a privilege, but a human right.
Wow. You guys are going into your senior year.
Yeah.
I'd say you're on a good track. And you're happy with the work that you've done together.
Yes.
That's really cool, really cool. Well, thank you for coming in and sharing. We appreciate it. We'll have to have you back as things progress. It'd be great.